All right, so for a respiratory exam in a newborn, you are going to first kind of start by assessing your patient. You're going to look and see how they're breathing. You're going to see if they are exhibiting any signs of difficulty breathing, which could be, some tachypnea, which is breathing fast. You would notice that their chest is rising really fast. Some grunting you might see. You can see some nasal flaring, which is, because babies breathe mostly with their nose, that means that they're struggling to breathe when you see this nasal flaring. They can have some retractions, so it can be intercostal, subcostal, substernal. You can see some head bobbing sometimes if they're really in respiratory distress. So those are all things that you'd kind of want to look at. You also would want to make sure that their breath sounds are equal. And you can look and just make sure that their chest wall is also rising equally on both sides. So first you just kind of look, you can palpate around and just see if you feel anything that feels abnormal. And you can see if there's any chest deformity that way. So then you're going to listen to your baby, and you're going to take your stethoscope and do the same assessment you would in an adult, just on a smaller space, but you're, listening in multiple areas, and you're going to compare each side to the other. And just make sure that the baby sounds equal across all of the sides. And you're going to go down, and you're going to keep listening, and then you can turn the baby over a little bit, listen to the back as well. So pretty much the exact same thing we would do in adults. It's just a smaller space to listen to. And having a pediatric or neonatal stethoscope does help. This is a little big for a newborn assessment, but it still works. You can still listen just as you would. So after you listen, and if everything's equal, then you can, continue your assessment of the patient.